an abbreviation NPO, go into a room with a patient, it's on the bed head or over the bed, and a practical nurse went in that room and gave that patient water. And I said to her, do you know what the meaning of NPO is? And she was like, it's been a member. And I was really, really mad.
If the export market is so attractive, is it such a bad idea for universities like UA and UTech who already have nursing programs to train Jamaicans for these positions overseas?
Thank you for that question, because yes, that's an excellent question. I have the current head. I have tried to introduce because of all the schools, I would not want to take up a school that is not of a certain standard to recommend to my head of school now to look at that. So I have asked for a sort of introduction, and we're following up on that sort of thing. Because yes, I believe that the University of West Indies School of Nursing has the capacity to build that career path, taking somebody from the allied health and carrying them straight up. The interesting thing is that for most of the program, and in this case I know this program well, it's 5 subjects they take in a month. So they have the students have the qualifications. And yes, we've had about 4 of them with degrees. 4 students who I believe, she says several, but I think but with degrees actually coming into the program. So this would have been a good addition to at least start a process. And then when we have the standardization of the others, then we could look to have them, join in with the program. The way I perceive this thing happening is that if we have an allied school attached to the UWI School of Nursing, there will be some courses that are taught to the nurses that they could do, basic skills things, first year things, so that by the time they are ready, if they want to move forward along that career path, they would have had some of these basic subjects. So we would have begun to link them from an academic standpoint going forward. I always believe, and I like to make this clear in whatever discussion I'm making, nurses are not to be trained. They are to be educated and trained. Because in many instances, if you see a certain activity with a patient, you have to be able to interpret that.
Yes.
So a patient who is very ill, and you notice their respiration start increasing and the blood pressure start falling, you must know what that means.
Yes.
And to be able, even if you are a allied worker, you have to be able to go and report, look, this is happening.
Right.
Patient probably going into shock.
Right.
So that now the registered nurse will come, raise the foot of the bed, start all the shock proceeding. So what I'm saying, we really need to have these people properly trained. And I use these people not in a derogatory sense, but we need to have this group of professionals properly trained and certified so that we could have this pathway that will take them forward. When we do that, we would have completed in nursing education in Jamaica from top to bottom. We'd have had a PhD here, we'd have the allied workers here, and we'd have a career path that could take them straight up to the top. And then we would be protecting our people here in Jamaica. And we will be protecting our reputation when we send them overseas. That's my position.
Could I get your input on it, the question about whether allied schools should be attached to universities?
I definitely think that it would be a very interesting, process. It is very important because I know of the EANs now, the enrolled assistant nurses here in Jamaica. They would have trained for 2 years. We, the RNs, would have trained for 4 years. However, they're not able to transition to a registered nurse at any given time right here in Jamaica. They would have, they would need to go back to school for 4 years to be an RN. Yes, right here, that's right here in Jamaica. So for the allied workers, covering everybody, it is very hard, and it is very important that you do that, because if you mold the foundation from here, it will be easier for them to transition into the registered nursing program, and so we'll have a better, workforce. giving better care, and so that when they even go abroad, we'll get better quality coming from Jamaica, and even taking care of our own people. Here in Jamaica, we get a better workforce to care for the sick here in Jamaica.
And
So it's very, very important.
the cost benefit,
Yes.
because to train a registered nurse is a huge amount of money.
Right.
But when you train an allied worker, they have all of the physical nursing skills and they are supervised. So one registered nurse will supervise 4 allied workers and you will get better quality of
And the
care
burnout is
for your
less.
people. Burnout is less.
Right,
So there's a
because
huge
you
thing.
will then get assistant
Yes.
at the bedside. So when you're there doing everything, because they have what do you call it? They're not able to do the type of skills that we can do. So sometimes they're useless, if I may say, at the bedside, because they're not trained to do certain skills. And even if something happens, they don't know what to report, what to identify based on the assessment, how you would come and say, okay, as sir was saying, patient is going, your pulse going up, your BP going down, come, let the nurse know that, oh, patient is going into shock. So you wind up the bed and you run, come, and you will inform us that something is happening. They don't know, they're not aware of these things. So it's like they're there, and we're still there as the person supervising and with every single thing, which doesn't make sense if we prepare them. Right.
Is there any truth to reports that some graduates are unable to do vital checks, and what implications does that have for Jamaica being a source market for practical nurses?
I must say that is true. I've seen it happen myself. Not just vitals, but things that they should know on graduation. For example, an abbreviation, NPO. Go into a room with a patient, it's on the bed head or over the bed, and the practical nurse went in that room and gave that patient water. And I said to her, do you know what the meaning of NPO is? And she was like, it's been a member. And I was really, really mad. Because this young lady had just graduated maybe about 6 months down the line. And you're in a private hospital. This patient just had surgery. It was not to take anything by mouth.
NPO means
Nothing by mouth. Nothing by mouth. And she's offering the patient water. Maybe it's just God sent me there at the time. Because the matron had asked me to oversee her. So it is happening. So one of my things is that what I would love to see is before these people go out there to graduate, after their graduation to go out to work, or before graduation, have somebody who will, as Nurse Spencer would have her consultants come in to check with these students before they go out. But these schools out there, they're not doing that. And honestly, for me, I think most of these schools out there are money-making thing, and everybody's calling it this Jamaican mentality, we have to eat our food. It's not supposed to be so. We are dealing with people's life. People's life. Yes, we are striving for the recognition, but if the schools are not helping, as Mr. Judge said, if we're not standardized, we cannot be recognized. And a lot of them keep saying, oh, I can't get this, I can't get this job, I'm not being paid for this job, and they do say a lot of things, but they are not up to par. They don't have the criteria to do what they're doing.
I could put my head on block. And there's a reason why I could put my head on block. Let me say 2 things before I put my head on the block for you. Fundamentally, I believe we're talking about allied health workers and for the export and stuff. There's a huge market right here in Jamaica.
I was waiting to come back to Dr.
There's a
Hayes.
huge market right here. They call me on a regular
On the
basis.
linkages.
Not only for the elderly, but mentally challenged. I spoke with Dr. Abel 2 weeks ago, and he was saying to me, I get 7 to 12 calls a week asking for places that will take my family or relative for a short time. He will say that people coming from Cayman Islands, when they come here for mental health care, they don't send them back right away. They keep them in a halfway house before they send. So apart from the fact that we send them away, there's a huge market right here. Okay? But if we have a set of people, we don't know what they know, but we're sure that they don't know some things, a lot of things, and I'll tell you about that one. If we have this set of people out there, unregistered, not identified, offering healthcare services to people, actually dealing with things like nasogastric tubes, tubes that run through the nose, down into the stomach, but if it goes in the wrong place, they go into the lungs, patient get pneumonia and die. And so there's a little joke that says, doctors and nurses bury their mistakes, literally, they bury their mistakes. No, I also, when people come for, the word is, I don't want to say recertification, but they trying to see what some of these people know. And I do some of that with the assessments, with SMTs. And it is amazing. You almost have to retrain them. You almost have to retrain them. Now, they come with an attitude of knowledge and power and authority, and how dare you tell me about this, but yet they don't know how to find the radial artery. They don't know how to put on a sphygmomanometer to take the blood pressure. They don't know how to walk a patient. They don't know how to deal with a patient who has fainted and is falling. They don't know how to carry out a full bed bath appropriately. They don't know how to clean, well, dressing is not but they don't know how to do mouth care. Can I go on? In other words, my opinion at this point in time is that for those schools who have had to do retraining for some of their students, these students almost need a course of retraining, because when we do the evaluation for them, they fail the evaluation so badly that they have to go through the whole period of retraining, education and practice, clinical practice, to be able for them to practice. Now that's the danger to the local population, because these are the people who are in homes out there and taking care of patients. These are persons who are assisting patients to take medication when they don't know the difference between metformin and anything else. All right, these they're here. All right, so that's the danger. And I could lay out a number of these because people talk to me about cases, and I've had to speak to them and stuff. I could speak to you because of my experience of helping to prepare some of them who want to go overseas. All right, but the fundamental issue here: how do we ensure that all of these people are recognized? Because one, they have been there are standards that all schools must meet. And if the schools do not meet these standards, they cannot go. But even in nursing homes, we know that some of them are not even registered, and they don't meet standards neither. So we're talking I am a person who would like to look at the whole picture. As they say in education, I'm a redundant holist. I like to see the whole picture. But here's the thing. So we have people with nursing homes here that giving people a chance to practice. Yes? And these homes are not registered, not up to standards. We have people being trained in schools that are not registered, that nobody knows what exactly they are teaching, but we know that when we test, the few that we test, they are not up to par. And these are the people who are going into these unregistered institutions here to get practice. And these are the persons who are trying to apply to go overseas.